All right. Hi, everybody. My name is Brittany Whitmore. I'm one of the physical therapists here at Carson County Memorial Hospital. Today, I also have Nicole Carroll. She's our case manager, and Bree Turner. She is one of our PAs here. I don't know if you guys have anything else to say on that side of things.
No, we're just excited to be able to do this and share the information, I guess.
So, starting off, like an intro to swing bed. So we are a critical access hospital, and so this allows us to provide swing bed services to receive skilled nursing and rehab closer to home. It's a transition for patients who are no longer needing acute care, but they're not ready for home yet. Skilled nursing and rehabilitation in our hospital setting is what you receive here. And so it's designed for a short-term recovery, and it's a great option for rehab because we don't have home health in our community, and it gives you the ability to recover after surgery, hospitalization, or injury. So next, eligible patients. So post-acute care needs. So if it's been a surgery, a stroke, an injury, some of the conditions we see are joint replacement, back surgeries, surgery after a fracture, wound care, weakness, we see pneumonia, COPD, exacerbation. I don't know, what are some other common ones that you can think of?
That's usually it. It's usually respiratory, bones, just any kind of, and sometimes it's just age because we don't recover as quickly as we'd like to.
So, in order to be eligible, Medicare Part A or some other qualifying insurances will cover swing bed. Our nursing services that we can provide IV medication, wound care, pain assessment, skin assessment, and 24/7 nursing and CNA care. On the therapy side, we provide services to help with mobility, strength, balance. We help you gait training, which is teaching you how to walk again. So if you've been injured and can't walk well, we help you learn how to walk. So our transferring, getting out of bed, learning how to sit and stand after surgery or after you're really weak can be pretty tough. So we can kind of teach you guys how to do that a little bit easier. Or if you're needing to use like a walker, a cane, or a wheelchair, we'll educate you on how to use those and which one's most appropriate for you and most safe for you. Some people after a surgery, they can't put weight on a certain leg, and those ones you learn how to either go without the one leg or however much your surgeon allows you to do. The other thing we work on is daily activities. So getting dressed, bathing, cooking. We can kind of work on making sure you can do all your activities of daily living before you go home. So our goals of swing bed are we want to improve your strength, function, mobility, and independence to return home. And we want to make sure you're able to do all your activities of daily living. So cooking, cleaning, or if you're not able to do all of those, making sure when we discharge you, you're set up with caregivers or you have the resources to be able to do these things at home. On the nursing side, they help teach medication management for some of the new medications, and then we're also doing a lot of family or caregiver help for home. So this is part of our care team. So we have 24/7 hospitalists, so Bree, and then there's a couple others that we'll go through in a minute. And then we have our registered nurses, CNAs, our PT, respiratory therapy, we have speech therapy if needed, dietitian, and case management. So to be admitted to swing bed, you have to be in stable medical condition. You have to have daily PT or nursing needs and a prior 3-day inpatient hospital stay. On your side of the case management side, do you have anything else?
So with the 3 days, what that means is that we actually have to have a condition that you're in the hospital, and even if you're here and we transfer you out, as long as it's 3 days or more, then that qualifies if you need to come back. And it gets a little wonky, so I don't worry about the math. It just, as long as we know dates and things like that, then I can usually figure those things out on the back side of things. But that's the most important, is that we have that at least established on the acute side.
So here are our providers. So Bree that you saw earlier, we have Chris Moore down here, Dane and Tamara Moody. So we always have some sort of coverage, and then Bree can say more.
Well, and we're also we work in conjunction with Dr. Dan Schumann, which I think a lot of the community members are familiar with. So he works with us integrally. So that way he's involved in all of the care, who we accept to swing beds, discharges, medical management, things like that. So he's also part of our party as well.
So then we have Nicole. Here's her information and a phone number if anyone ever needs any of that information. And then on the therapy team, there's me, we have Connor Lighting, also in the room, and then Brian. So on average, the length of stay for patients is 1 to 3 weeks. You can have a longer stay if medically necessary. You have up to 100 days, and so we have to make sure for Medicare that you're meeting certain guidelines if we continue to use days. Everybody, we create an individualized care plan, so we make sure we're meeting your needs, your goals, and we had a patient who wanted to get to a family reunion, those kind of things. We try and really work towards your own goals and getting you home at a certain time, and we understand it's a small community and we want to kind of be able to work with that in a small community. Discharge planning, it begins at admission, so we kind of look at what does your home look like, what does your support look like, how are things going to work on the outpatient side, getting to doctor's appointments, in town with transportation or the bus, we kind of think about those things, or if you're going to need outpatient services, physical therapy, or following up with your doctor, we want to make sure we have all of those set up when we leave here, and all of that starts that first day. And coordinating with outpatient. So some of the benefits are being able to have continuity of care within the same hospital. So some of our swing bed patients are here in the hospital and they stay for a couple days and then they transition to swing bed. And those patients don't even really notice a transition. They stay in the same bed and same room, but then they're just on the back end side of things and the rehab side of things. That's where a lot of the changes happen. So it's actually a really nice thing for them. It's a lot less movement and going from room to room. It's also a familiar environment for the patients. A lot of people know our hospital and have come to visit a family member. So being able to come here and be able to just be comfortable with people and a lot of the nurses and docs and just some local people. So swing bed is nice because it can reduce readmissions. So if someone's pretty weak after being hospitalized, if we do swing bed, get them strong, get them safe to go home, we'll see less acute care readmissions. So one of the benefits is when you're in our swing bed, we can get you to see all the physicians that come to our specialty clinic. So whether it's orthopedics, your cardiologist, the surgeon, neurology, everyone who comes to swing bed, we can easily, or come to specialty clinic, we can easily get you upstairs, or some of them come down to the rooms and we'll see you down there. So here's a picture of our rooms. So the one on the left side is actually our swing bed activity room. So there's some nice chairs, coffee, a TV if you just want to get out of your room. The other side is the patient room. So if you've ever come to visit a patient in the hospital, it's the same room that you would have for the hospital. We had a couple success stories. So this first one, swing bed is great because you're getting to come back to your local community. You don't have to stay in Denver. You can come back home and get physical therapy and nursing services. It makes you feel like you're back home. It's very important to the healing process. And then another one, swing bed has a great nursing and CNA staff. They're always willing to help. Therapy helps you to get stronger. The staff here is way more personable than in the city. It gives you time to get strong enough to return home. And then the last one, rehab was terrific. She would highly recommend it, the use of swing bed to the community. So we've had a lot of people who've enjoyed being able to come back home. Some of these, I think, people have either just come from our acute care, our hospital, and then transitioned to swing bed, and a couple of them have been transferred from Denver. In the transfer from Denver, you could probably explain the transfer from Denver process better.
So what it looks like, especially on my end, is when you're going out to Denver, usually, I want to say 8 out of 10 times, they're going to want to keep you in services there at that hospital system. But I usually work on the backside with case managers wherever the patient is at and coordinate that care, wait till they're medically stable, and then help them figure out transportation back to here and get all the admission. When we do get those referrals, and that's what we call them, just the consultations back to us, it has to go through Bree's team, it goes through Brittany and her team, and then, we kind of coordinate with nursing to make sure that we have everything for that patient that they're gonna need for that stay, so that there's no surprises. So everybody has a say in the matter, and everybody gets a vote, and then we kind of work with that other hospital system to get you here as soon as possible. And sometimes we work and work and work, and then it gets delayed, and that's okay on that end. We don't give away the beds. We wait until you're ready to come. So a lot of phone calls, a lot of background foundations, things like that. But one of the things is you may, as the patient or the patient's family, may have to advocate to have to come home, because that's the other thing is the hospitals, they want to keep you there. It's easy for them and it's good money for them. They don't think about being that far away from home. Sometimes they think that the world ends in Aurora, and they forget about the other distance from Aurora to the Kansas line where we're at. So we have to educate them about our hospital. So don't be afraid. If you go, take my number, have them call me, and I can always start that way. But I do my best to try to loop around and make contact first, but sometimes that doesn't work. So don't be afraid to say, hey, I really know that this happens at my hospital. I want to go home. And then we work on that process as well. So it can be cumbersome.
So kind of looking at our length of stay, in 2024, the average was 7.5 days. And in 2023, the average stay was 15.4. And of course, you have the people who are a little bit shorter, and then the people here who are maybe 6 to 8 weeks, kind of depending on what their needs are. And again, making sure we're meeting their needs and it's medically appropriate. So how to refer and admit, internal process. So if you're here for acute care, we're working with the docs, we're working with PT, we're gonna kind of all make that assessment if you're gonna be an appropriate candidate for a swing bed. And so then we'll kind of determine that. And when you're here, it's a super easy process. You don't even really realize
It's all
that's
paperwork.
happening.
It's all paperwork on that end of it. It's just a matter of flipping the codes for billing. So you never see a change in services.
So those external ones, so those Denver hospitals, front range hospitals, like Nicole said, she is in contact with those case managers. Those case managers reach out and send us a big packet of all your information. And then from there, we make a decision as a team. Are we able to meet your needs? Are you going to benefit from swing bed? And so then that whole work of admission starts there. So required documentation, that you have to have a referral, you have to have your 3 midnights, and then insurance verification, that's something that Nicole does. And like Nicole said, sometimes those hospitals in Denver don't know we exist out here and don't know that we provide therapy services and rehab services. So with that, we want to make sure that, you can ask for it. You can say, I want to go back home and I want to have therapy and rehab in my home community. And then those case managers should reach out to us and get the ball rolling on that.
One of the other things too is understand that even if you don't initially, if you're in the Denver area or even here and you go home after your initial stay and you're not doing so well at home, there is a possibility that you can come back and still get evaluated, and we can do the work on seeing if that qualifies for a swing bed. So just because you go home doesn't mean that process stops for a certain period of time. It is time limited, but that's something that we can review and see what we can work with. So just because you do, don't suffer at home is the end game.
Does anybody have any questions about swing bed or coming back to swing bed?
Yeah, or I think the biggest benefit for our swing bed program here, and we've said this since we've been coming out here, the biggest thing is we want to have great care here. Because if you're in the city, then guess who else is in the city? Your significant other, your mom, your dad, your brothers, your sisters, and that's expensive. and it's hard to get there, and then you're uncomfortable, and then you're staying in hotels if the hotel's available, or you're staying in an ICU room that's uncomfortable. And from my recent personal experience with my mom being in the ICU, it's awful. My parents live in a tiny little town. They don't have this option, so they're at my house. Thank goodness they're at my house, but I see my dad, he's exhausted. And so at least he comes home to a safe place where he can sleep, he can rest, so he can really be there for my mom. So it's actually thinking not only of the patient, but also of the families, and so that way they can be there at their best supporting. And I think it's just great, their success stories, really getting home back to your normal life, what that looks like. I think that's really, really important for us to advocate, not only for our patients, but for our families and our support systems. And then they can learn how to help take care and help to support each other. I think that's super important.
I got a question. You may have already addressed this, Nicole or Brittany, but how do we know if our insurance that's being accepted by the hospital in Denver will be accepted down here if we transfer down here? Will we get like pricing information or, those financial concerns? How would we know that ahead of time before we bring our services down?
So typically, with the private insurance, that's a little different. We run those through, if that's something that we need to get an authorization for a hospital stay, we kind of do that on the before you get here type of thing, so we know that we have all of that in line. Medicare is usually the easiest and pretty straightforward, especially for swing bed, is that as long as we have medical necessity, they give us 20 days to figure it out, and they pay 100%. So that's kind of one of those that, we have a little bit of time to play with as far as helping you get there and not have to worry about that financial burden. But that's something that we could, if there was a special case on a private insurance that you're like, hey, just, can we kind of check that out? As soon as I get that information, I can get that through our admissions team for authorizations and see if we can help get that more ballpark number for you, at least on that.
And on that note, so Medicare covers 100% for 20 days. After that, it dips down a little bit, but your secondary should cover. And so Nicole will be working with you or the family, making sure they know, do you have a responsibility, or does your secondary pick up whatever Medicare is not going to cover after 20 days?
So yeah, and sometimes it's a case by case, to be honest. I've had those where we have to kind of figure it out on the fly.
Perfect, thank you.
And again, that's the beauty of it in our small community is we don't have 50 patients. We have 5. And so you get that real personalized care. You're going to be seeing the same faces. We probably have taken care of somebody in your family. We have the time, we have the space, we have the desire. And I think we understand the uniqueness of this community, what we have and what we don't have. And so that's why I really, really feel strongly about swing beds here.
And we like seeing them go home.
That's true.
When they get better. That's it. If I would say that's my biggest joy in all of that is being able to successfully get them from Denver, get them here, get them stronger, and then watch them walk out. That's probably the best, to be honest. Well, this is wonderful. I'm glad we got to do this.
Yeah. And if you do have questions, like you can, on the rehab side, you could reach out to me or Connor. On the case management side, Nicole knows a lot of that. So reach out to us if you do have questions or if you're in need of services. We're more than willing to help you.